shock. While Donald Trump is bragging about remodeling bathrooms at the White House, Americans are panicking about how they will afford health care next year. I read an article from ABC News that interviewed a photographer from Utah who gets her health care through ACA. She will go from paying $495 a month, already outrageous, to $2,100 a month, an increase more than 4 times. It's more than her mortgage. And that is Donald Trump's America. Americans pay more for health care than they do on their mortgage. It's outrageous, and it just puts an
Hey everyone, welcome back to 45th Perspective. I'm glad you're here because today we're going to dig into a major Senate hearing that has implications far beyond the walls of Capitol Hill. One that touches the lives of ordinary Americans in a very real way. But before we dive in, if you like what we do here, please hit that like button, subscribe to the channel, and ring the notification bell so you don't miss future episodes. And if you'd like to support our work, help us keep making thoughtful, fact-driven videos that go beyond the headlines. You can join us on Patreon at patreon.com/45thperspective for as low as $5 a month. Every bit of support helps us stay independent and bring you deeper analysis on the stories that matter most. Now, let's get into it. The hearing in question was one of the most charged and revealing sessions we've seen this year. Senators convened to question key federal health officials over the growing crisis in healthcare affordability and the alleged political interference within major health agencies. It wasn't just another partisan shouting match. It was a reflection of how government decisions, made in rooms like these, ripple out into the everyday lives of millions of Americans struggling to afford basic medical care. To put it simply, this hearing was about trust. Trust in government, trust in science, and trust that the system works for the people, not against them. So today we're going to unpack what happened, the arguments made by both sides, and why it all matters. We'll also look at what this hearing reveals about the state of American politics and where the balance lies between oversight and interference. Let's start with a bit of background. The Senate hearing focused on the operations of federal health agencies, particularly the Centers for Disease Control and Prevention, CDC, and the Department of Health and Human Services, HHS. Lawmakers were responding to recent revelations that several career scientists at the CDC had raised alarms about political appointees pressuring them to alter or rush vaccine-related recommendations. According to testimony from one former CDC official, high-ranking figures within HHS were in daily communication with the White House about changing the national vaccine schedule, decisions that, under normal circumstances, would be made solely through scientific review and advisory committees. This official alleged that these discussions often took place without the input of the very experts who were supposed to guide those decisions. That statement alone sent shockwaves through the room. It raised the question, was science being overridden by politics? Now, in fairness, the administration defended its involvement, saying that leadership has a duty to ensure that federal agencies are efficient, responsive, and aligned with the broader goals of the government. They argued that political oversight doesn't automatically mean political interference, that elected leaders should have a say in setting priorities, especially when those priorities have national implications. But that's where the line starts to blur. How much oversight is too much oversight? During the hearing, Democratic senators pressed witnesses on whether political appointees had overstepped their bounds, putting ideology ahead of evidence. They pointed to the pattern of public health decisions being announced before data was publicly released, suggesting that communication strategies, not science, were driving the timeline. Republican senators, on the other hand, questioned whether these agencies had become too insulated, too slow, and too bureaucratic to respond to public needs. They cited past instances where government scientists resisted oversight, arguing that transparency and accountability are essential for a system funded by taxpayers. And honestly, both sides have a point. When it comes to health policy, Americans want decisions to be rooted in science, not politics. But they also want transparency. They want to know that the people making decisions that affect their families are accountable to someone. One of the more powerful moments came when a senator read testimony from a Utah photographer whose health insurance premium had exploded from $495 a month to over $2,100. She said, "It's more than my mortgage, and it's supposed to be health insurance." That line seemed to hang in the air, a reminder that behind every policy debate are real people facing impossible choices. That's when the focus shifted from process to impact. Lawmakers started pressing for answers about why premiums are rising so sharply and why government programs meant to provide relief seem unable to keep up. Economists testifying before the committee pointed to several factors: hospital consolidation, pharmaceutical monopolies, administrative overhead, and yes, policy uncertainty. When leadership changes direction every few years, insurers and providers adjust pricing to hedge their risks. In other words, political instability itself can drive up costs. But what really caught attention was how some senators used this opportunity to pivot toward the Affordable Care Act. Democrats pushed to expand premium subsidies and strengthen consumer protections, arguing that without them, millions could lose coverage altogether. Republicans countered that expanding federal programs would only deepen the deficit and that the private market, given freedom from regulation, would eventually correct itself. This ideological clash isn't new. But what made it interesting this time was how grounded it felt in human stories rather than abstract talking points. People are hurting, and both sides seemed to at least acknowledge that, even if they disagreed on solutions. Still, the hearing revealed some deep contradictions. For instance, while some lawmakers criticized the administration for interfering in scientific decision-making, others demanded more political control to rein in what they see as unaccountable bureaucrats. It's a paradox, calling for both independence and oversight in the same breath. And maybe that's the larger lesson here: democracy is messy. Governing a country as diverse and polarized as the United States means walking a constant tightrope between freedom and structure, science and politics, autonomy and accountability. At one point, a senator asked a former CDC official what she believed was the single biggest threat to public health right now. Her answer was simple: mistrust. She explained that when Americans don't trust the information they receive, when they believe decisions are being made behind closed doors or for political gain, they stop listening. They stop following guidelines. They tune out. And that, in her words, is more dangerous than any virus. That statement seemed to shift the tone of the hearing. Even some of the more partisan senators nodded in agreement. Because here's the truth: the erosion of trust isn't just about this administration, or the last one, or the one before that. It's about a pattern, decades of dysfunction, overpromising, under-delivering, and spinning the truth for short-term gain. Americans have grown cynical because they've been given reason to be. Now, personally, I think hearings like this are necessary. Oversight is healthy, but they only work if they lead to genuine accountability, not just sound bites. If senators walk away from these hearings and nothing changes, then it's just performance. And we've had enough of that. So what could change? For one, there's growing bipartisan support for increasing transparency in how federal health decisions are made. That means publishing the data behind major announcements, disclosing who's in the room when key choices are made, and creating public logs of political communications that could influence agency policy. Another promising idea is the creation of an independent review board, a nonpartisan body made up of scientists, economists, and public representatives, tasked with auditing health policy decisions for both scientific integrity and cost-effectiveness. Think of it as a watchdog with no allegiance to either political party. And beyond that, lawmakers on both sides agreed on one thing: healthcare costs are spiraling out of control. Whatever your ideology, when families are paying more for insurance than for their mortgage, something's broken. That's where the debate gets tricky. Democrats tend to see this as a moral failure of capitalism, that the government has to step in and correct market imbalances. Republicans see it as an economic failure of overregulation, that government interference drives inefficiency. Both narratives have truth in them, and both ignore certain realities. In reality, the healthcare system is a hybrid, public and private, regulated and free market, and the flaws come from that tension. Every time we shift the balance one way or the other, new problems emerge. That's why I think the hearing's biggest takeaway isn't about who's right or wrong. It's about how the system itself creates incentives for dysfunction. Politicians posture, agencies defend themselves, and meanwhile the American people are left holding the bill. If you step back and look at the pattern, it's easy to see how we got here. For decades, health care policy has been treated as a partisan trophy rather than a shared responsibility. Each administration tears down what the last one built, not because it doesn't work, but because the other side built it. The result? A patchwork of laws and programs that don't communicate with each other. A system that's both too big to fix and too fragile to function. So yes, this hearing was about one administration's actions. But it was also about the cumulative weight of years of political short-termism. Now, if we zoom in on ordinary Americans, what does this mean? It means continued uncertainty about premiums and coverage. It means families juggling medical debt. It means patients skipping prescriptions to pay rent. It means young people delaying care until emergencies force them into hospitals they can't afford. That's why this issue isn't just policy. It's personal. When government works, it gives people stability. When it doesn't, it magnifies anxiety. And that's what so many Americans are feeling right now. Uncertainty, exhaustion, frustration. In my view, both parties have to stop treating healthcare like a political chessboard. Real people are the pawns in that game. I also think we, as citizens, have a role to play. It's easy to get cynical and disengage, but hearings like this are reminders that the system still works, at least partly because of public pressure. These issues only stay in the spotlight if we keep asking questions, writing letters, showing up, and demanding transparency to us. So where do we go from here? For one, we need a national conversation about what health care in America should actually look like, not just how to pay for it. Is it a public right? A private commodity? Something in between? The lack of consensus is what keeps us stuck. Second, agencies like the CDC and HHS need to rebuild public trust, not just through statements, but through consistent, transparent action. That means letting science lead, communicating clearly, and acknowledging mistakes when they happen. Third, lawmakers must resist the temptation to weaponize hearings for political points. Oversight shouldn't be theater. It should be governance. Ultimately, the Senate hearing reminded me that democracy isn't about perfection. It's about process, and process only works when people participate. So to you watching right now, I'd say this. Stay informed, stay curious, and don't fall into the trap of assuming one side has all the answers. The truth is rarely that simple. What matters is that we keep demanding integrity, from our leaders, our institutions, and ourselves. Thanks for spending this time with me today. I hope this breakdown helped you make sense of a complex issue and see where the debates really lie. I'd love to hear your thoughts. What do you think about how the Senate handled this? Do you believe political influence in science is a real threat? Or do you think the government has to play a bigger role to keep agencies accountable? Drop your thoughts respectfully in the comments below. I read as many as I can, and I love hearing your perspective. And if you found value in today's video, please give it a thumbs up, subscribe to 45th Perspective, and consider supporting us on Patreon at patreon.com/45th Perspective. It really helps us continue producing the kind of independent analysis you won't find anywhere else. Thanks again for watching, and until next time, stay informed, stay thoughtful, and stay engaged.
Shock. While Donald Trump is bragging about remodeling bathrooms at the White House, Americans are panicking about how they will afford health care next year. I read an article from ABC News that interviewed a photographer from Utah who gets her health care through ACA. She will go from paying $495 a month, already outrageous, to $2,100 a month, an increase more than 4 times. It's more than a mortgage. And that is Donald Trump's America. Americans pay more for health care than they do on their mortgage. It's outrageous, and it just puts an anchor around the financial anchor around the ankles of every family. And what is Donald Trump doing in the middle of all this? This horrible sticker shock crisis that people are just feeling so awful about? Well, if you watched Donald Trump this weekend on 60 Minutes, you saw a president utterly dismissive of the pain his policies have caused working people. While people are paying more for everyday expenses, Donald Trump went on TV to insist that everything is fine. He claimed yet again that we have no inflation in this country. The only problem, that's a lie. Trump, talk to the average American and tell them they have no inflation as they're paying more for everything. Particularly this weekend, they learned how much more they're paying for health care. And inflation has accelerated, actually accelerated, since the start of Trump's trade war. Donald Trump also celebrated that grocery prices are going down. Which grocery store does he shop in? Probably none. But when Donald Trump celebrates that grocery prices are going down, it's a surprise to people who actually shop at grocery stores, because they're seeing prices go up and up and up. And when Donald Trump was asked what he's doing to end the shutdown, he said his usual nonsense, it's the other side's fault, utterly ridiculous. Donald Trump is the president. People look to him to negotiate, to fix problems. Finally, I will note this. Donald Trump was also asked several times what his plan is for fixing health care. And what was his answer? Pure gibberish, because he doesn't have a plan for health care. The only plan Republicans have for health care seems to be to eliminate it, and then to tell working people to go figure it out on their own. That's not a health care plan. That's cruel. But it's what Republicans have tried to do with health care for decades. We all remember the moment when John McCain rebuked his party to preserve it. Democrats have been very clear from the start. We need to lower people's health care costs. We need to reopen the government. We need to extend the ACA premium credits. That is what a majority of Americans want. This horrible sticker shock crisis that people are just feeling so awful about? Well, if you watched Donald Trump this weekend on 60 Minutes, you saw a president utterly dismissive of the pain his policies have caused working people. While people are paying more for everyday expenses, Donald Trump went on TV to insist that everything is fine. He claimed yet again that we have no inflation in this country. The only problem, that's a lie. Trump, talk to the average American and tell them they have no inflation as they're paying more for everything. Particularly this weekend, they learned how much more they're paying for health care. And inflation has accelerated, actually accelerated, since the start of Trump's trade war. Donald Trump also celebrated that grocery prices are going down. Which grocery store does he shop in? Probably none. But when Donald Trump celebrates that grocery prices are going down, it's a surprise to people who actually shop at grocery stores, because they're seeing prices go up and up and up. And when Donald Trump was asked what he's doing to end the shutdown, he said his usual nonsense, it's the other side's fault, utterly ridiculous. Donald Trump is the president. People look to him to negotiate, to fix problems. Finally, I will note this. Donald Trump was also asked several times what his plan is for fixing health care. And what was his answer? Pure gibberish, because he doesn't have a plan for health care. The only plan Republicans have for health care seems to be to eliminate it, and then to tell working people to go figure it out on their own. That's not a health care plan. That's cruel. But it's what Republicans have tried to do with health care for decades. We all remember the moment when John McCain rebuked his party to preserve it.